Head-to-toe examination. Preparing for the examination. Gather necessary equipment. Before beginning the examination, instruct the patient to empty the bladder and remove as much clothing as possible and put on a gown. Remember to respect modesty. Close doors, use drapes, and leave the room while the patient is dressing or undressing. Allow a third party in the room if that helps the patient feel more comfortable. Upon entering the room, wash your hands and apply gloves as appropriate. Make sure to tell the patient what you will be doing before you begin the examination. Sequencing. Integration of the head-to-toe assessment requires rehearsal and repeated examinations to develop comfort and confidence. It takes time for the procedure to flow naturally. Learn to adapt to a situation and establish a routine that feels comfortable and natural to you. Develop a systematic pattern that is efficient and comfortable for the patient and that will prompt you not to omit parts of the examination. Of course, there is no one correct way to put an examination together. The goal is to create a sequence that will flow very smoothly, accommodate the patient, and make it easier for the patient in that she or he will not have to make numerous position changes. Any approach may need to be adjusted to patient-specific conditions or disabilities. Components of the physical examination. Patient seated and facing examiner. Head and face. Inspect skin and characteristics. Inspect and palpate scalp and hair for texture, distribution, quantity, masses, parasites, or lesions. Inspect face for appearance, expression, symmetry of structure and features, and movements. Ask the patient to raise his eyebrows, frown, smile, and open eyes against resistance. Note strength and symmetry of facial muscles for cranial nerves 5 and 7. Evaluate sensation awareness of the forehead, cheeks, and jaw on each side of the face for cranial nerve 5. With the patient's teeth clenched, palpate the masseter and temporal muscles. For the eyes, inspect the corneal light reflex for symmetry. This is called the Hirschberg's test. Perform the cover-uncover test. Assess extraocular muscles for movement through the 6 cardinal fields of gaze. Assess position and alignment of the eyes. Inspect eyelids and eyelashes. Inspect lacrimal apparatus and conjunctiva. Inspect the sclera for color and clarity. Inspect pupils. Pupils equal, round, reactive to light. Perform fundoscopic assessment. Observe the red reflex. Inspect the optic disc. Inspect for retinal background, hemorrhages, exudates, and lesions. For the ears, observe for position, size, shape, and symmetry of pinnae. Carefully palpate each ear separately. Apply pressure to the tragus. Inspect the ear canal and tympanic membrane using an otoscope. Test hearing acuity, the Weber, Rin, and Whisper tests. Nose. Inspect the external nose for overall shape, symmetry, and edema. Inspect the skin around the nose for lesions, color, and irregularities. Palpate the bridge and soft tissues of the nose. Inspect the sinus areas for edema. Palpate and percuss sinuses. Inspect the nasal cavity. Assess the nasal cavity for patency and the nasal septum for continuity. Assess the turbinates for color, texture, and discharge. Inspect the color of the mucous membranes. Test sense of smell, cranial nerve 1. Thank you for your attention.